Um, but good afternoon, everyone. Again, my name is Sarai Ramos. I am with the Latino Action Network Foundation. Um, just in case you are not familiar with the LAND Foundation, we are a 501c3 charitable organization that is dedicated to the social economic empowerment of the Latino, Latinx, immigrant, Black and Brown communities across the state of New Jersey. I'm going to stop sharing my screen. But so today we are here to discuss and learn a little bit more about the Louisa Carmen Medical Debt Relief Act, which bans the reporting of most medical debt to credit reporting agencies and adds critical financial protections for patients. This bill was recently signed into law on July 22nd of 2024 by Governor Phil Murphy and marks a significant victory for health justice in our state. I want to take a second to introduce our guest speaker, Laura Waddell, who will be discussing more about this bill in detail, along with other important health initiatives, such as the Cover All Kids initiative, Medicaid Redetermination, and Open Enrollment for DACA recipients. Laura is the healthcare program director for New Jersey Citizen Action, which is a statewide grassroots organization that has been working for over 40 years to promote social, economic, and racial justice in New Jersey. She leads Citizen Action's healthcare policy and outreach work and convenes the New Jersey for Healthcare Coalition, a partnership of over 70 organizations dedicated to expanding access to quality, affordable healthcare for all New Jerseyans. Most recently, Laura spearheaded the effort to pass the bill that we are talking about today. Also co-leads a growing working group focused on alleviating the harms caused by medical debt and leads New Jersey for Affordable Drugs campaign, which has passed historic prescription drug affordability reforms in the state. Thank you again, Laura, for joining us today and for your incredible leadership on these critical issues. And we are very excited to hear more from you. Please take it away.
Thank you so much, Sarai. And so thank you, Lan, for having me. You are such great partners and have been such great partners of ours. And so this is just such, I always look forward to doing these events with you. So I am ready for my first slide. Yeah, so I figured we could talk healthcare. We'll definitely talk some know your rights and focus on the medical debt credit reporting. But I also thought we could give some additional updates that are that'll be helpful for you to know in healthcare. So let's get started. Yes, and so as Sari mentioned, Citizen Action is a statewide organization. We have our direct service side, which provides free services for tax preparation, financial coaching, first-time home buying, rental, foreclosure, counseling. There's fair housing discrimination work and services, and free healthcare enrollment assistance. And then on our advocacy side, of course, there's healthcare. We do all things healthcare, we like to say. There's a workplace justice program that deals with things like paid family leave. We have our consumer protection and financial justice program that does a lot with like student debt, predatory lending, and things like that. Of course, good government and electing progressive leaders and the Fair Auto Act. Next. So we should just start out with medical debt, just to give you an idea as to the issue in our state. It's medical debt is something that is created involuntarily through no fault of your own. No one should have to have their credit scores ruined just because they got sick. It causes having the debt causes numerous or exponential negative impacts like bankruptcy, litigation, of course, damage to your credit score, ability to access jobs and housing, uh, loss of home and household goods, and more. And in New Jersey, there's about 1.5 million people who are struggling with medical debt, and 1 in 3 report that their medical debt has prevented them or someone living with them from seeking the needed medical care that they need, which is just so disheartening to hear. And then also something to note is that, like with so many other healthcare issues, there are disparities within medical debt and collections. And of course, as with the disparities elsewhere, communities of color are typically affected in larger proportion. And so 32% of New Jersey consumers in communities of color have debt in collections compared to 16% in white communities. Next slide. So what we're really doing is trying to address medical debt in a comprehensive approach and trying to really hit it at a few different angles. And so our coalition partners are working on how to policies regarding how to prevent medical debt from happening. So policies that make healthcare more affordable. And we're also working on policies that will strengthen protections for healthcare consumers, such as the Louisa Carmen Act. And then we are looking to do some change in the system, in particular in the court system, and change how medical debt is tracked and really try to divert medical debt from even getting to court in the first place and providing more harms. And also, of course, supporting policies that alleviate the financial burdens and harms that people are struggling with every day. And so, with that comprehensive approach, we feel that we will be able to help more people in a greater and more meaningful way. Next slide. So as Sari mentioned, the Louisa Carmen Medical Debt Relief Act was signed into law over the summer. And thank you to so many of our partners who've supported this. And as she mentioned, it bans medical debt from being reported to credit reporting agencies. That became effective on immediately as soon as it was signed. Also, what was effective immediately was the enforcement and accountability measure, which means if any medical debt that was reported, that you find reported to an agency in violation of the law, is to be voided or canceled. That amount is to be removed and voided. So this is a provision that not every state who has passed legislation like this has. And so New Jersey is one of maybe 3 or 4 states that has a provision like this. And so this is one of the many things that makes New Jersey's laws stand out as a model for other states who are looking to pursue this. And then in the coming year, there are some great provisions that will take effect by next July. One is the notice to consumers. So any collection communication to consumers that's covered under this law must any any communication to those consumers must include notification about this new protection, which means it must let people know that should they find a that a debt amount, a medical debt amount has been reported, they have the protection of the enforcement protection that it is to be voided. So any collection communication has to include that. And so this is coming effective and active in the coming year. So next July. Another great provision is that any medical debt, the interest rates for any medical debt is now capped at 3%. So if you know, are making a financial arrangement or anything that's related to medical debt, you cannot be charged more than 3% interest on it. And then also, the law prohibits wage garnishments for medical debt for residents up to 600% of the federal poverty level. And this is pretty, you know, a really nice range or threshold, in that for a single person, I believe that's about $90,000, up to about $90,000 of your annual income. If you make up to that much, no one can garnish your wages for medical debt purposes. And for a family of four, I believe that's about I believe it's about $160,000 or $180,000 if your household income is up to that, then you cannot have your wages garnished either. So that's, you know, these are really great provisions that are protections really that are coming available in the coming year. And also there's some parameters that were created around reasonable payment plans between patients and providers. So no more can anything go when it comes to making a payment plan with your provider. They have to follow some rules of the road. So these are some of the, you know, helpful provisions that that are included in this law. And I do want to note that the ban for the medical debt is for most medical debt, and so there are people who may use medical debt credit cards to pay for their health services, and not all medical debt credit cards are covered under this law. So if you use a credit card like Care Credit, you just need to make sure that you check with your lender to find out if you were to use that card to pay for your health service, if it would in fact be covered under the Louisa Carmen Medical Debt Relief Act, so that you would be informed before you would use that mode of payment. And I think we're ready for the next slide. And so that's happening in New Jersey on medical debt. And I thought that I would just let you all know that there are some federal efforts happening that will ban the reporting of medical debt across the country. And this is a proposed rule, I should say, by the Consumer Financial Protection Bureau. And also they're proposing that lenders would be prohibited from using information, I guess, obtaining and using information about medical debt to make credit eligibility determinations. So that's, you know, would be really helpful because then you're no longer saying that medical debt could be a factor in determining whether you get a car insurance, or whether you get a house, or anything like that. So that would be a big help to healthcare consumers. And then also, I always say this, but I can't believe that these type of things happen. But the proposed rule will also prohibit lenders from taking medical devices as collateral for a loan. So it would ban the repossessing of medical devices. And that's like prosthetic limbs or wheelchairs. I mean, I can't believe that people would repossess a prosthetic limb. That's just, every time I say that, I just can't believe that that happened. So these types of actions would be banned should the rule become approved. And so just wanted to let you all know what was coming down the pike, and something to look at to make sure that we stay on top of these federal efforts too. And it's always good to have both federal as well as state efforts, because they say it's even better to have belts and suspenders, just to make sure that you're secure and protected. So that's why it's always good to have state and federal. And then we wanted to let you know that we have some resources for you. If, of course, I do not expect you to remember everything that I'm telling you today, but we have a fact sheet. And the Spanish translation is coming soon. So right now it's in English only, but we do intend to make it available in Spanish. But basically, it just gives you a quick snapshot of what to expect in the Louisa Carmen law, and what's covered, what's not covered, what it does. And then what's also nice about this sheet is it provides information for folks who, should you find that the law has been, that your medical debt has been reported in violation of the law, it gives you exactly where you can go and who you can tell. So you would report that to the Office of Consumer Protection. That's in the Attorney General's office, and it gives you three ways in which to report it. There is the first little link there is a complaint. A link where you can report the complaint. The second is an email where you can send an email about what you found. And then the third is a phone number where you can contact them. And you would, submit your complaint to alert them, and then the Attorney General's office would look into it. And then we also have a little QR code, but it's also, the link is on this slide too. And this is an opportunity for anyone who would like to share their medical debt story. By all means, do and join the advocacy, because as we spoke of before, there's a lot that we're not done yet with medical debt, and there's a lot that we have planned to continue to do to provide protections for our New Jerseyans. And so we would like to hear if you or someone you know has a story about having medical debt. We would like to hear about it. We would also be happy to hear if you be interested in getting more involved in sharing your story, like in as testimony in a legislative hearing, or writing a letter to the editor, or really anything like that. So be happy to hear from all of you. And we can go to the next slide. So just letting you know a little bit as to what are the near-term next steps in medical debt now that we've been successful with the Louisa Carmen bill. Next, we are looking to um, make healthcare even more affordable for people on the state healthcare exchange, those who are able to purchase ACA marketplace plans. And so we're supporting a lower cost, better value a bill that will help to um, helps to make the better value gold plans even more affordable than the middle tier silver level plans. So that is something, if you would like to get more information about, there's a link there. And if you'd like to join in the advocacy, we welcome. And then we're also looking to bring even more to strengthen health care consumer protections even more. And there is legislation that focuses on protecting families from losing all of their bank account funds, their household possessions, and homes from aggressive debt collectors. And so, this uh, um, legislation is really for all debt, not just medical debt. So it would help everyone. And it's really focused on, trying to make sure people are not debt collected into the street without being able to have money to continue to live and a place to, live and so really trying to protect our healthcare, our consumers in general, but our healthcare consumers from these aggressive debt collection practices. Next slide. So now that's all about medical debt. And so I thought that we could spend a few moments just giving some healthcare updates on a number of issues and things that you may be familiar with, and just needing an update as to the status as it currently stands. So next slide. So Coverall Kids, I know so many of us have heard of this, and this has been a wildly successful program. As you know, this is starting in, well, the legislation was passed in 2021, but the expansion which would allow for all children, regardless of immigration status, that was became effective last year in 2023. And so with New Jersey Family Care for children up to, or I should say, under 19 years of age, household incomes of 355% of the federal poverty level, or that's about $9,200 per month for a family of four, are able to enroll in New Jersey Family Care. So there's no waiting periods, no premiums. This does not count against public charge. And so there are comprehensive list of healthcare services that your child would be able to access. And so, from preventative to vision to vaccinations and so many other things as well. So, we want to make sure that we continue to spread the word. I think at last count, there were over 41,000 undocumented children enrolled in this in New Jersey Family Care. And so we are so excited by that. I know school has already started. We're a month in to school now. And so we want to make sure all of our children are covered as they go through the school year. I also included a link to the application checklist, should that be helpful for people, so that you can see, what is it that you need to complete an application for New Jersey Family Care for your child. Next slide. And this is just kind of information on who is eligible for New Jersey Family Care. We just spoke about the children through the Cover All Kids, but there's adults are also eligible to enroll in New Jersey Family Care. So adults earning 138% of the federal poverty level, I should say up to, which is equal to individuals that make about $1,700 a month, or for a couple, $2,300, a family of four, $3,500. And then also pregnant women who are up to 205% of the federal poverty level, which is about $2,500 a month, and or a family of four, $5,300 a month. So, if you know anyone that is falls within those thresholds and they would like coverage, by all means, please let them know, and let them know they can all about New Jersey Family Care. Next slide. So I know that a lot of people who've been enrolled in New Jersey Family Care for the past year or so or longer have had to go through what's called the unwinding of the and restarting of Medicaid redeterminations. And just a quick refresher, during the pandemic, the the determinations or eligibility renewals for Medicaid or New Jersey Family Care were paused during the pandemic. And so because, the pause was temporary, last year, the that renewal process restarted. And there was a 12-month period in which, they had to go through the whole rolls of New Jersey Family Care, all I think it was 2.3 million people had to go through the renewal process. And everyone should have received renewal packets, and that they needed to complete to submit to determine whether or not they were still eligible for New Jersey Family Care. Well, now that that process has, that initial restarting has finished, and now it's, just the ordinary annual renewals, we just wanted to let you know that if you had missed submitting your renewal packet, now that it's after the ending and the grace periods of that, the Medicaid redeterminations, you will need to reapply for New Jersey Family Care at this point. But folks who are who went through that process and perhaps were appealing their decisions, they will have they're in the fair hearing, I should say, the fair hearing process. And so those folks, just know that the state has said there's a backup and a backlog. So they're still actually trying to work through those the fair hearing requests and appeals. And so during that time, people should not be losing their coverage. And when you go through the fair hearing, it means that you had received a notice that you were terminated. You are no longer eligible for New Jersey Family Care. And so if you thought that was in error, then you're allowed to submit for a fair hearing to appeal that decision. And during that process, your coverage should still remain active. So just wanted to, let people know that who are going through that, so you know your rights there. Next slide. And this is currently we're in the special enrollment. So folks who are not enrolling in New Jersey Family Care and Medicaid health program because they are over the income thresholds, you would like to have health insurance, you can enroll in Get Covered our Get Covered New Jersey state exchange. There is, which I'll talk about in a second, there's an open enrollment period that starts November 1st through January 31st. And when in the between time, or I should say, between February 1st and October 31st is what's called the special enrollment period. So if you don't get the open enrollment, and you have any one of these special criteria, life-changing events that should happen, like your immigration status changes, perhaps before you became lawfully present, and your immigration status changed, where before you were not able to enroll in an ACA plan because of that immigration status, and now you are. You can, and that happened you can enroll within a 60-day period of that life-changing event. If your income changed, whether it went up or down, you can enroll in an ACA plan. And so, if you lost your health coverage, if you expanded your family, if you were married or divorced, and just know that for the special enrollment, if you have one of those life-changing events, you have to enroll within the 60 days of that event in order to be able to participate. And then just another note is that anyone who has a family income of $29,160 for an individual, or $60,000 for a family of four, they are allowed to enroll in an ACA plan all year round. So this is just just letting you know what your rights are here in regards to accessing health coverage. Next slide.
Laura, I actually had a quick question on this.
Yeah.
Does this also include people who age out of their parents' health insurance?
This does. So like if you're if you lost your, this would cover, this would go under the loss of health coverage. So if you lost your health coverage because you aged out of your parents, like if you became 26, 27, if you turned 27 and you aged out of your parents' health insurance, that would be a special circumstance, and that you could, so long as it's within 60 days of your birthday, you can enroll. Otherwise, you would have to wait until November 1st. So just so you make sure that I'm clear, all of these special enrollment or life-changing events, you could, if you have one, you can enroll through the special enrollment period. Otherwise, if you miss the 60-day, cutoff, you can still enroll, but you would have to wait until open enrollment. So you could enroll between November and January.
Awesome, thank you.
Yep. And so now, as I mentioned, open enrollment is November 1st through January 31st. And that is the cover page for our state exchange, Get Covered NJ. And you're able to go to the site, you're able to see what you would qualify for in regards to any financial assistance. You can see different plans, and even now that it's not open enrollment, but you can still go and use the plan comparison tool and be able to see what's available for you come the next open enrollment. Next slide. So it's just good to know that most people do qualify for financial assistance. So most enrollees, about 9 out of 10 or 90% of enrollees qualify for financial assistance, and they will lower the cost of your premiums. And so for some folks, you might even qualify for cost sharing reductions as well. So like your co-pays, which you would pay out of pocket for certain income levels and certain plans. There's additional financial assistance available there. So, and the financial assistance comes from both federal and state subsidy assistance. So, next slide. Yep. And so this just, lets you know who would be eligible for for the state exchange for an ACA. So, it's for people who don't have insurance, of course. So uninsured New Jersey residents and dependents. You must be a U.S. citizen or national. If not, you must have the determination of lawfully present. And if your plan, folks who can also enroll, if you have employer coverage, your employer plan has to be considered unaffordable. So, they will look to your employer plan first. And if that is deemed unaffordable, then you would be able to enroll in an ACA plan. And so people under 65 years old are able to enroll in an ACA plan. And the big news that Sari mentioned earlier is that starting this November 1st, DACA recipients are eligible to enroll in an ACA marketplace plan. So that is amazing. That means, I think in New Jersey, that is about 15,000 people who will be able to get coverage, are eligible for coverage. And I think that's about 100,000 people nationally are eligible now for coverage. So we're getting there. We're expanding coverage, little by little. Unfortunately, at this time, undocumented residents are not eligible for coverage under the ACA. So, but, as I mentioned, for children under 19, undocumented children under 19 are eligible to enroll in New Jersey Family Care through the Get Covered, the Cover All Kids initiative. So it's, all children should be able to, almost all children should be able to access health coverage. Next slide. And I put this in there because I just wanted to let folks know that you can go to the Get Covered site to enroll in coverage. And it doesn't matter if you if you would qualify for a Get Covered plan or a New Jersey Family Care plan, but you only have to complete one application, and the system does the work in determining which plan that you need to go to. So the system does all the work for you, whether you're a new enrollee, whether you're re-enrolling, and again, like I said, whether it's Marketplace or New Jersey Family Care. Next. And so I did mention that they're, for the ACA, they're unfortunately undocumented. Adults are not able to enroll in an ACA plan to receive financial assistance, or also unable to enroll in a New Jersey family care plan if you're an adult. So there are still healthcare options out there for this population of people, and also others. Doesn't matter if you're undocumented, if you have insurance, if you have Medicaid, or New Jersey Family Care, whatever. Federally qualified health centers are here to help. They are in every county, and they have, they will see you regardless of your immigration status and regardless of your ability to pay. And so the centers have a comprehensive list of services, and from primary care to dental, lab services, and more. So it's worth taking a look to see if your health service if they will satisfy your health service needs, and at the very least, it's a place where you can go if you do not have health insurance or are not able to enroll in a health insurance plan. Next slide. And I know that we talked about some of the many, healthcare wins, the medical debt. We've got the Cover All Kids. Last year, the legislation was passed to create a prescription drug affordability council, and this council is sole mission is to analyze the pharmaceutical system in the state, and to analyze all the actors, like the manufacturers and the pharmacy benefit managers and all the everyone who feeds into that system. And they're really looking for what is driving up the costs of prescription drugs in New Jersey. And so they look to identify what those cost drivers are, and the board will create actionable policy recommendations for the legislature and the administration that will lower the cost of prescription drugs in the state. So, and for everyone. And so the board is made up of 5 public members and 3 alternate members. And so those members have to be appointed before the board can get to work. And so we're in the final stages of the appointment confirmation process. And so the last 2 board council members are being going through that process right now. And so hopefully this month we'll get some good news, and those will be shared, and the final appointments will be made so the board can get to work. But I just wanted to let everyone know, if you were following the prescription drug reform efforts, that especially the Prescription Drug Council, that this is we're getting there. So we just and we'll be sure to keep you posted with ways in which you can engage with the council, and any of the policies that the council comes up with. We'll be sure to keep you all posted. So stay tuned for more on that. And some of the emerging policies that I just, kind of wanted to give you a heads up on. We spoke already about the availability of the eligibility of DACA recipients So that's wonderful. But we also spoke about Cover All Kids before, and we know that, all kids, the whole intent of Cover All Kids is so that all kids are eligible to enroll in health coverage, in particular New Jersey family care. There are some children, and that's regardless of immigration status, but there are some children who are above that 355% of the poverty level, that income level. And so there needs to be some type of healthcare or insurance product created for those children to be able to enroll. So the last update that we received from our Department of Banking and Insurance was that they were looking at January of next year, perhaps for as a go live date for those children there to be able to enroll. But we will keep you posted. Once we have more definitive information, we will certainly let you know, so that we can all spread the word and make sure everybody knows about that. And then within that same legislation that brought about the Cover All Kids, there was also a pathway for a New Jersey Family Care buy-in program that would allow for adults to be able to purchase coverage, adults who are barred from purchasing coverage in New Jersey Family Care. So that is a policy that we collectively as coalition members are working on. And so we will keep you posted as that progresses, and let you know how you can join in the advocacy of that. And then lastly, we spoke about the medical debt court diversion program. We're really trying to keep medical debt out of the courts. And so as that comes to fruition, and there's policy and legislation there to support and advocate for, we will let you know that as well. Slide. And so I wanted also for you to know about some federal healthcare policy updates. And so many of you may have heard that over the summer, for those who are in Medicare, so 65 and older, there has been a release of the Medicare negotiated price list for the first 10 drugs. And so I know it's small here, but I'm sure you'll be able to see it when you get the slides. And also there's a link to the list of these 10 drugs. But there are negotiated prices now that for Medicare that will help so many seniors who use drugs for things like diabetes and blood diseases, and so many more. And so one thing that I will note is that the prices go into effect in 2026. So we still have another year to go before seniors will be able to see these prices in effect. But over the next year, there will be additional drugs added that are to this negotiated list. And so they're going to keep adding more and more drugs to that. And so this will, certainly help a lot of seniors to save more. And then I mentioned how when people are enrolling in coverage on the state exchange, the ACA, or an ACA plan, they're able to get financial assistance to help pay for their premiums. Well, there was the Inflation Reduction Act, which is a federal statute that passed a couple of years ago that allowed for even more money, even more subsidies from the federal government to go into making those premiums more affordable, go into adding to the financial assistance that people were able to receive. Well, those enhanced premium tax credits are set to expire at the end of next year. So there's going to be plenty of efforts over the between now and then to become engaged in calling for Congress to make those tax credits, enhanced premium tax credits, permanent. So we will certainly pass along and keep you posted with any of those efforts. Next slide. And so this is us at Citizen Action, our advocacy team. And I know that I showed you in the beginning all of the different programs, advocacy programs. So if you needed to or would like to reach out to any of those program department directors, they are here in addition to our organizers as well. And so all of our contact information is on this slide if you needed to reach out to us. And on the last slide are the phone numbers and email addresses for our direct services that was listed on that slide as well. So in particular for healthcare enrollment assistance, it has the phone number to call, or you can send an email to request or to schedule an appointment with one of our healthcare enrollment assisters. But there's also in contact information for all of our other direct service programs as well. And I think that was it. Yep. So if anyone has any questions, I'll be happy to answer. I should also say I haven't been paying attention to the chat, so if anyone had a question there.
So Laura, as we wait to see if any questions come in, I just had a quick one regarding the upcoming provisions for the medical debt that you discussed at the beginning of your presentation. Where do we stay informed on when those come into effect?
Yeah, so the banning provision and the enforcement provision, like that voiding provision, those are already in effect. It was effected at the stroke of Governor Murphy's pen. Everything else is by next July. So it will take 12 months for the others to become effective. And then those will be, so July of next year, you can expect that those will be need to be up and running.
Awesome. So it doesn't look like we have any other questions, but in case anyone does have after this webinar is over, you can feel free to email me. I will be sending up a follow-up email with today's presentation slides, the recording for today, and as well as additional information on public charge, Cover All Kids, and different areas that Laura did touch base on. But I think we can go ahead and close out our webinar. Thank you all for joining us today.
Thanks, everybody.
Jess, if you can end the webinar, I don't have the option to.